CFR 3.309 provides service connection for veterans for chronic conditions related to exposure, such as Agent Orange exposure, and also chronic illnesses that develop within a year of active duty service. These conditions should be service connected on a presumptive basis, meaning the veteran doesn't have to prove a link between the condition and service if they meet the criteria in the law. An example of some of the chronic conditions that can be service connected if they develop within a year of active duty service are arthritis, kidney disease, hypertension, diabetes. So if a veteran has symptoms of that condition and it gets diagnosed, they should be service connected for that condition as long as it developed within that year of service separation. What many veterans don't know is that you don't necessarily have to have a diagnosis of that chronic condition within that year period if you can show with competent evidence that symptoms of that condition developed within that 1 year period, those symptoms continued until the current diagnosis of a chronic condition, you can win service connection for that condition on a presumptive basis. So here's an example. A veteran who has chronic knee pain within a year of service separation. They complain to their family and coworkers that they have knee pain regularly. They have to take ibuprofen, they limp, maybe they have a limp sometimes in the morning, whatever it is, when the knee flares up. And eventually, even after that year period, they see a doctor, get an x-ray, and the doctor says, you have arthritis of your knee. That veteran can win service connection for that arthritis of that knee if they're able to show competent evidence that the symptoms of that chronic knee problem developed within that 1 year period and continued until the current diagnosis of that condition with the current symptoms. So a veteran can have a family member or a colleague at work write a lay statement, lay evidence, stating that they observed the veteran having chronic pain in that knee and the dates, the period of time that they saw that veteran having chronic pain in the knee that was within that 1 year period after separation. That lay evidence can be competent to show that the veteran did in fact develop that chronic condition of arthritis of the knee within that 1 year period, even if the diagnosis happened after that 1 year period. So that's the law surrounding presumptive service connection for chronic illnesses, and how even if you were not diagnosed with a chronic condition within that 1 year period, if you had symptoms and you can show competent evidence of those symptoms within that year period, and the symptoms continued until the current diagnosis, you can win service connection for that condition on a presumptive basis.
The information contained in this video is informational and not professional advice. Rely on it at your own risk and see a qualified medical or other professional to discuss individual circumstances.